Kia ora everyone and welcome to our first webinar of the year. My name is Dr. Grace Lee. I'm a general practitioner and I'll be moderating this session. We'll be talking about tackling burnout and thriving in the future. And tonight I have the pleasure of talking to Dr. Fiona Moir, who is a senior lecturer at the University of Auckland with a background in general practice, and she holds a number of different positions within the university. All right, Fiona, I'll be handing over the presentation to you.
Kia ora katoa. Thanks, Grace. Welcome, everybody. Thank you for attending a session in the evening. I know how precious your time is when everybody is so busy. So what we're going to be doing tonight is speaking together for about an hour. Please do feel free to ask any questions and Grace will ask me them. We'll do some part of the way through and we've left quite a lot of time at the end. And I'm going to be presenting with my two hats on. I've got a university role and I've got a role with Connect, and I've got permission to use bits of information from both of those sources. As you can tell by my strong New Zealand accent, I'm originally from Edinburgh. Okay, so we're going to be covering tonight, we're going to do a bit about stress, what stress is, what the stress response is, and the stress vulnerability model, and having a think about some ways to intervene. Thinking about early warning signs of stress as well. And then we're going to move on for the next bit to look at burnout and what is burnout, what are the signs and symptoms, and what are some strategies. And then at the end, I'll do some more on general self-care strategies. And I really wanted to spend a bit of time looking at some resources, because I'm aware everybody here will have different things that they wish to look up. There will already be many skills and strategies you have, and much knowledge that you already have. So the key to these sorts of sessions is to add one or two new things to your toolbox, as it were. So we're going to start off with stress. And I really want to think about stress and the stress response. So I'm aware this is a reminder for many people watching. So what is a stress response? Well, something happens and we perceive it as being stressful, okay? And when we have a perception of something as stressful, we then will start to think about it and think this is stressful, I'm feeling really stressed. And because of that, we will have a mind-body interaction and our physiology will kick in, our adrenaline kicks in, and then we will start to have a stress response. So all the things you usually might notice, your pulse rate might go up or you start sweating. And then what happens is we actually notice the signs from our stress response, and that can make us start thinking and feel even more stressed. So if you take an example of that, I could, for instance, perceive public speaking as being stressful. I don't particularly with my job, but let's say I did. I find public speaking stressful. I might find it stressful. Someone else might not find it stressful. So it's not the stressor itself that is causing the issue, it's the perception and the reaction that an individual person is having, okay? So here I am, I'm perceiving that public speaking is stressful. I'm doing public speaking now, and I'm starting to think negatively about it. Oh my God, nobody's watching, everybody's actually making dinner, people hate Scottish people. I'm having a random series of thoughts, and those are making my adrenaline kick in, and it is setting off a stress response, okay? And now I'm noticing that my voice is getting shaky and I'm swallowing and I can't think properly. And then I notice that I'm responding like that and it makes things worse. Okay, and this is a sort of cycle that happens with a stress response. The reason that it is useful to know about it is that it's possible for you to intervene at various points in that cycle. Okay, so if we take that example, I could be starting to talk and I could start to feel stressed. I don't like public speaking, and I could start to, the thoughts could start off, people don't like me, you know, I'm no good at this. And I could notice them. Wait a minute, I'm having those thoughts about not being any good at public speaking. And I could actually choose to just let the thoughts go past me, not engage with them. A bit like you're on a train station and you're standing on the platform and just letting the thoughts go past instead of jumping on the train. And if that happens, then I won't have a stress response. I won't have the mind-body connection of that happening. I will just stay calm. Okay, so let's say I don't manage that. I buy into the thoughts, I jump on the train, I start to get stressed and my voice gets shaky and I get all wound up. I could intervene then. I could think, my goodness, I'm all shaky. I can't think clearly. I need to put a strategy in place to calm my nervous system. And it's very important, I think, for all of us to have a series of strategies we can use to calm our nervous systems. A really simple one would be diaphragm breathing, where you just take a slow breath in, a belly breath people will talk about, and your belly moves out, and then a slow breath out. So breathing in and your belly moves out, pull your belly in, and there's your slow diaphragm breath. And when you do that, your body will think, oh, I'm actually relaxed. I thought I was stressed, but I'm relaxed. It'll switch off your adrenaline, and you will notice that your mind clears and you're able to speak again. Okay. So that's an example of a stressor being like public speaking, how two people can perceive it differently, and how our perceptions, our thoughts, and our response of our body and thinking about that can link into a cycle, and how we can actually intervene at these various points in this cycle. So I thought we'd have a look at a PowerPoint. I'm trying not to do too much PowerPoint tonight because I know that people have enough of these things in their lives. So I'm just going to put mine up here, and we'll just look at a couple of other things about stress together. Okay, here we go. So this is a curve that's well known to people, the Yerkes-Dodson curve, and it's really just about how much stress is actually useful. Can stress be useful? And people have different names: distress, eustress. It doesn't really matter. The concept is that a little bit of stress, if you don't have any stress, often people aren't doing things, they're not very motivated, there's not much happening, there's not much pressure, and we're sort of drifting along, but often we don't get much done. We often need a little bit of pressure or stress to get something done, and then we start working a bit harder and we start focusing more. And then as we carry on with the demand getting higher, we can start to perform better and better, and we can get to our optimal level of performance here. Okay. And this is a good place to be. You're performing, you're right at the top of your curve, you're doing really well. If we carry on getting more and more stress and more pressure, you can start to slide down the other side of the curve. Performance gets less optimal. You might get really anxious, and if it carries on and on, you can become more disorganized. I was watching Craig Hassad from Monash, who teaches a lot of mindfulness. He's one of the doctors there who's a world expert. And he was talking with this curve, actually, how it is possible to get yourself up to this optimal peak. And then if you train yourself in a skill like mindfulness, how you can actually stay really calm and get your performance even higher and hone your skills and come up to this bit of the curve. So I thought that was interesting. But I think the useful thing about this curve is to think about where you generally like to operate. So some people do things in advance and they pretty much sort of live down this lower part of the curve, and they tend to get on pretty well. Other people tend to live up at the top of the curve and do things at the last minute, right on the peak. And that can be useful, but it doesn't really leave you any leeway when something happens. So it's a good idea, if you're a person who tends to operate right at the top of the curve, to be aware of that and to try to pare things back and do things a bit more when they are less urgent if you can. So my tendency is to be up here and do things at the last minute. And I have to force myself on a regular basis to try to put myself a bit further down the curve. So you will know where you are on this curve. So that's just thinking about how much stress can be useful. Another thing I wanted to introduce tonight is the stress vulnerability model. So this is the idea that all of us are on this spectrum with our psychological health, and we slide from being well to being more unwell throughout our lifetimes and back. This is just the way that it works, mental health. And this dotted line here is our resilience threshold. And this is something that is different in different people. It's got a sort of biopsychosocial origins, multifactorial. And in life, we have day-to-day stress. So this is your ambient stress, your stuff that needs done, your building that's getting built, the mortgage that's happening, stuff with the kids, just day-to-day stress. This is all of our lives. And on top of that, we have superimposed peaks of stress, okay? So something happens, might be a new job or a separation or somebody dies. And this is what life is like, that we will have day-to-day stress. And on top of that, we will have these peaks of stress, life events. And everybody has this. Nobody's life isn't like this. We all are like this. And as you can see from this diagram, often when we have a peak of superimposed stress like this, it will tip us from being more well into being more unwell. It can tip you over your resilience threshold. And so the idea of a lot of these stress management skills, what you're basically trying to do is you're trying to raise your resilience threshold by learning some skills. And skills-based techniques can raise your resilience threshold so that when you have your next life event, which you will, you don't go over the dotted line, okay? There are many of us, and sometimes in your life, you will have noticed that actually your day-to-day stress is right next to your resilience threshold. You're sort of wobbling along the line. And that can feel like a pretty emotionally fragile place to be if that's happening. So it's very good to have an awareness of that. And if you do feel that you need to raise your resilience threshold, this is where you want to start working on it. So techniques that people use here, like people who are getting into doing something like meditation, that's the sort of thing that you can choose to work on in an ongoing way. You can't suddenly raise your resilience threshold. Oh, I need to raise it before this job interview tomorrow, because it doesn't work like that, unfortunately. It's something you decide to put some work into, and you can learn to raise your threshold. Okay, so with stress, it can be really useful to look at things that we currently perceive as stressful. Thinking about what is your perception, noticing it when it happens, thinking about the way you respond to stress, and I'm going to talk in a little bit about your early warning signs, and also thinking about how you cope with things, what skills you have, what your coping mechanisms are, what your mindset is around stress. Do you think stress is terrible and it shouldn't be there, and you get, you're really upset about it and ruminate about it or worry about it? Or do you think, yeah, bring it on, it's all part of the job and I see it as a challenge? Your mindset does have a part to play in this. And what support do you have and what resources are available? Because it depends how well resourced you are at the time. Okay, and this is a useful equation. I do like equations. So you can think of distress as being when the demands are more than your perception of your ability to cope. Okay, and why this equation is useful is that you can often change one of the three things. You can sometimes change the demands. You can always change your perceptions, find a different way of looking at it. That's sometimes what people will do when they go and get some, go and see a therapist for a few sessions and say, I'd like to learn a different thinking pattern, a more helpful way of looking at this. You're changing your perception, or why two people will view a situation, the same situation, differently. And you can learn some coping skills and mechanisms. You can't always change the demands in a particular situation. It might be that at your workplace at that time, you do have to do that, but you can often change the demands somewhere else in your life if you can't change them in one place. So you can look at the whole of your life for demands. Okay, this is a handy diagram for people who want to try to work out what it is that's stressing them. This is called worry bubbles, and this is Louise Webster, who's a child and adolescent psychiatrist. She used to do this with children. In her practice. It's very useful. I've used it in general practice quite a few times with all sorts of people. You basically just get a bit of paper, draw some different bubbles on it, and then you put all your worries into the bubbles. You put the biggest worry into the biggest bubble, and the smaller worries in the other bubbles. And the key to this is not to censor things. So if you write something in the bubble, that's in the bubble. It doesn't, you can't sort of judge whether it should be there or not. So you just have to do it without censoring. I've done this with my children, for instance, and one of them said, why are all my friends in the bubbles? They're supposed to be my friends, which was the first inkling I got of what was going on there. So handy exercise, worry bubbles. And then once you've done that, you can problem solve it, which is where you can maybe apply the stress equation to it, right? Looking at these worries one by one. Can I change the demands? Can I change my perceptions? Is there something I can do or some help I can get or a skill I can learn that's going to help me with this particular worry? So this is worry bubbles, just keeping an eye on my time here. And just thinking about your early warning signs of stress. So we spoke about when you might peak over that dotted line. And one of the handy things about our bodies and our minds is that we all have a lot of early warning signs of stress. And it's useful to know what yours are, and you will have lots of them because you are human. So no matter how good you are at managing stress, you will have these early warning signs of stress. And so there are psychological ones. So a lot of things that your mind does when you're stressed. There are different ways that you behave. So you will recognize yours in here. Some of them we're more aware of than others. So people aren't necessarily aware that they might overspend or interrupt more or something like that. And we have a whole raft of physical ones because of our mind-body interaction. The really useful thing about early warning signs is that often you'll get the same ones in a sequence. So you start to be stressed and you lose your sense of humor and become a bit irritable. A week later, if you're still stressed, your sleep pattern changes, and 2 weeks after that, your psoriasis kicks in. So you can actually write your early warning signs of stress out on post-it notes and order them. If you're not sure what your early warning signs of stress are, you can ask the people you live with. They will love to tell you, and or the people you work with, and then you can be receptive to what they say. You often learn things about yourself you didn't know, and they can be really specific things like you stop singing in the shower, your partner might tell you, something you weren't aware of. So the key to this is you write down your early warning signs of stress and you link them to some sort of plan. Okay, when I stop singing in the shower, I'm going to start going back to the gym, or I'm going to get more sleep, or I'm going to be careful around how much alcohol I drink so I'm not self-medicating, you know, that sort of stuff. Okay, so I just want to move on to burnout. Of course, if you have any questions, please do send those to Grace. Do you want us to answer any questions on stress now, Grace, or shall I keep going?
I'd love to just ask a couple of questions if you don't mind.
That's fine.
So just sort of thinking around that lovely model that you brought up towards the beginning of your talk, looking at the physiological mechanism towards stress. There's a question in the audience just really wanting to know about the long-term effects of physiological stress and how that actually impacts on the body.
Okay, so unfortunately, the long-term effects of stress will have impacts on many of our systems. So, you know, a short burst of adrenaline is one thing, and we're sort of designed to, you know, to cope with that. And people always talk about, you know, saber-toothed tigers, and that's what it was meant to be like. But when the saber-toothed tiger is there day after day, hour after hour, that's not what we're meant to be coping with. So, unfortunately, then we will have high cortisol production, and that has a whole raft of effects on, you know, heart, immune system, you know, links to diabetes, all sorts of things. So it, unfortunately, and skin issues, virtually every system, GI effects, you know, irritable bowel, all sorts of stuff like this. So I think inflammatory bowel disease, it's very important to try to pick it up before it gets to that stage. So I do have slides, I haven't put them up tonight, but it can just show you the evidence for it. But it is virtually every system if you look for it.
Okay, just one more before we move on, just sort of looking at that, you listed some of the behavioural responses that may be early warning signs of stress. And one person in the audience has noticed that when you have a look at those signs and symptoms, often they also pop up in things like depression. So in terms of the link there, are we thinking that at times what we may be considering as a depressive illness may actually be early warning signs of stress and burnout?
Well, I mean, absolutely. I think it's interesting, isn't it? Because something like depression, it's a category, it's a diagnostic category that we make, you know, in a particular country at a particular time with a particular manual will say, if you have this group of symptoms, we say you have this disorder. And I think that there are pros and cons of diagnosis, of course, but I do think that it's just not quite that clear cut. So, you know, we have sort of symptoms. Yes, it could be leading its way into depression. That's why I like drawing that sort of as being well and more unwell, because it's not like you're completely well and then suddenly you're diagnosed with something. You know, we sort of merge into it. So I think at a certain point, it will spiral into a very clear, you know, depression, major depressive disorder or something which is diagnosable. But yes, absolutely. Sometimes those things are the starting signs of depression. If left untreated, it could spiral down in that direction. It's depending on the other risk factors that are happening.
Okay, thank you, Fiona.
That's right. So we're going to do burnout now, and I thought what we would do just to make things slightly more interesting is I read you a story, saying as it's the evening, and I'd like you to listen to 4 symptoms and signs and consequences of burnout, and then you could write what your ideas are about that to Grace. And especially interesting thinking about the consequences of burnout. So this is a story, so you can carry on cooking your dinner or closing your eyes and lying on the floor if you want, doesn't really matter. Okay, this is a well-being presentation after all. So Surrounded by the womb-like familiarity of exhaustion, he focuses on the job, the muffled sounds of the outside world, a daily backdrop to ignore. Dragging his flickering attention back to the task at hand, he grinds out another day's work, dutiful, resentful, and defeated. He's unaware that apathy has narrowed his view and affected those around him who've given up suggesting anything new. Opportunities and risks drift by unnoticed. His problem-solving ability has become dulled by the routine. Enthusiasm, self-respect, and creativity are words from his past. If you feel as if you're stuck inside a box, why bother thinking outside of it? He only sees what's in front of him, and he only does what's required of him, limiting, unfulfilling, and dangerous. There's no point in him saying anything anyway, because nobody listens. And he stopped listening years ago to other people and to the part of himself that made him good at his job. Even though you're here, you're not really here. His wife's frustration at his lack of presence boils over into an argument as his weariness and disconnection seep into his home life. On some level, he realizes something's wrong as he limps from holiday to holiday when he briefly re-emerges and they both catch a glimpse of his old self. But on another level, the daily grind has become a safe haven from change and conflict, which have always terrified him. Weeks turn into years. And if somebody had asked him, well, what are you going to leave behind? What do you want to achieve with your life and your work? He would only have glanced at them dully with unseeing eyes before returning to the job. Okay, so that's a story about burnout, and we're just going to discuss some signs and symptoms. So if you want to send those to Grace, and consequences, I think are a thing that often we don't think about with burnout. And then I'll go through what some of the key points of burnout, what it actually is, signs and symptoms, and some measures you can take. Okay, Grace, what did we get in?
We are waiting for things to trickle in. Everyone, if you're wanting to ask a question, don't forget, please just go down to the bottom of your menu bar, click on the Q&A icon and just type in your question.
I must have made everybody feel so down after reading that depressing story. It is just a made-up story to group the signs and symptoms and consequences of burnout. It's not a real person, so I'm sorry.
That's a good story. All right, so someone's popped in some symptoms of, they're talking about lack of interest, beginning to feel as though there's a sense of learned helplessness.
That's a good phrase. Absolutely. So quite a passive sort of, this person's response to burnout is to be quite passive and hopeless and be very hard to change, wouldn't it, when you were feeling like that?
That's right. And that's sort of on the sort of other way of looking at it as well, that narrow vision in terms of not really wanting to take risk and not wanting to explore outside the sphere of what is known is a problem for him as well.
And I like the way that you've used the narrow vision, because that's exactly what it's like when we're feeling burnt out. We just go into survival mode and we just sort of do the minimum. And we've been like that ourselves in the past. I'm sure other times you've worked with people like that, and it does affect the team when people are working like that, because it's quite unpleasant for them and for others working with you. It sort of does seep around you, I think.
That's right, and that is definitely mirrored in the comments with regards to people noting the impact of his behaviour on friends and family, and someone's actually commented they must be awful to live and work with, and by your description we can certainly understand why.
And I think at that time, you know, it's an unhappy place to be. So just to acknowledge, it's very common. Burnout is internationally, they think about 50% of final year medical students are burnt out. It tends to be worse in more junior people in a profession, and actually become less as you become more senior, which is interesting. And that's the same for nursing and vets and dentists and doctors. And there's various reasons for that. So sometimes people think it's when you've been there for ages. It's actually more younger people starting that have more of a tendency to burn out. So let's just have a look at what it actually is. So burnout is a syndrome that's got three core components. It's got a stress dimension, which is really emotional exhaustion. You get stressed, you get more emotionally exhausted, you get more stressed in its own little cycle. You've got a second dimension that's about how you connect with other people, your ability to connect with others at that time. And when somebody is feeling burnt out, we tend to be more detached and cynical. I'm quite like that anyway, but I just put that down to being Scottish. But when you're burnt out, it can be like that becomes a normal way of being. And one of the words that is used there often is depersonalization. So that's sort of treating a person like they're not a person. There's a chest pain in the waiting room, and that sort of language being used all the time. Somebody's very disconnected. And then the last strand is this one about efficiency. You're not feeling very efficient. You're not being very efficient or feeling very efficient, really. It's a sort of effectiveness strand. So those three things, exhaustion, cynicism, ineffectiveness, that's what's going on within the individual. And I'm just putting this rectangle around the outside because burnout is also to do with the system. So it's not just an individual, it's an individual within a system that has stuff going on that impacts on them. And it's a sort of interplay between the two things, the system and the person. The two main drivers of burnout are demands, which are well known. People know that that's one of the things that causes it, or can be partially attributable, that can partially lead to it. But conflict's one of the other big things. And here this can be ongoing conflict at work with colleagues, or working in a place with high conflict with patients or whatever, but also it can be internal conflict. So if you're trudging off to work every day, wishing that you'd done something else with your life, that's internal conflict, and it can be a driver for burnout. And there are other things which also can affect the picture, how much autonomy you have. And people, when they have more autonomy, tend to be less likely to burn out. So this is why I suspect younger practitioners are more likely to burn out, because you get less control over what you do and you're sort of told what to do. Skills use. So if you're highly skilled in an area, but you're not being able to use that in your current job, often that can be a risk factor for burnout if that's an area that you really liked. And also working somewhere that you feel is unfair, you're not being fairly recognized for what you do, or somewhere that doesn't align with your values. These are other things. And all of these things can feed into the picture. They're in the system that can feed into these factors within an individual. So it's quite a complicated sort of interplay of factors. These are the consequences here. We heard some in that story, but our personal health, physical, emotional health, professional consequences for talking about the people around you, more chance of error, making error. So patient safety consequences, and for the workforce, obviously with attrition, people are more likely to leave or be at work but not be fully present at work. So some of the signs and symptoms, I've put them on here, but we had some in the story. And there are things people know about. The core symptom really is exhaustion. Physical and emotional exhaustion is your core symptom. Lots of things on here. We've got some team symptoms of burnout on here. Lots of them, too many to put on a slide. But also there are measures that can help, too many to go on a slide. And I will give you a reference of where you can find this information if you want to have it. So lots of things in there. Educational activities, you're doing that now. There you are, you're in the middle of a measure of preventing burnout. So if you want to find that, I really like that article. It's from 2009, but I really like it. If you just Google being connected, a key to my survival, then you can get a PDF of it. It's freely available. And it lists the signs and symptoms. It lists the evidence base of stuff that works. There's not that much new stuff that's come in since then. Really, there's more organizational strategies that have come in since. And it also has some nice anecdotal things from practitioners about how they integrate some of these things into their day-to-day life. So it's a very practical article, okay? Just moving on, thinking about organizational strategies. So the most effective thing to manage burnout is an individual taking some action, some of the things on that list, recognizing it and acting when it happens. So this can be as straightforward as something like noticing those three strands, you know, I'm feeling exhausted. What can I do to have more energy? So that's things like nutrition, exercise, watching what you're, drinking with alcohol, like this sort of stuff, sleep, core sort of things there. Or it's the middle strand that you're noticing. What can I do to be more connected? I worked with a clinician who noticed that that was the thing that used to happen with him. And he used to, when he noticed that happening, he would go around the ward and find a patient that wasn't his patient and talk to them and say, what brought you into hospital? And just connect with that patient when he wasn't listening to fix. And he found that when he did that, he would do it regularly. It would get him out of his burnout and stop sliding further down the scale. Or it might be the third one. And then you ask yourself, oh, my efficiency's really slipped. When did I last feel effective and efficient? What was I doing then I'm not doing now? So you basically keep an eye on this all the time and just notice what's happening and then try and slide yourself back up the other end of the scale. Some people will be saying easier said than done. It can feel like that. So it's useful to think about it actually before you're in a bad place with it. Think about some measures you could put in place for you. I want to touch on organizational strategies. So it's very clear from interventions that have been written about in the literature that by far the most effective ones are ones where individuals learn some skills and organizations put some things in play at the same time. Okay, and that's by far the most effective way to manage and prevent burnout. And there's a lot of being written about organizational stuff now. This is a really fantastic article from the Mayo Clinic, and it is really practical, 9 organizational strategies to promote engagement. And it has things on it like a little exercise you can do with your team at work if you want to sort of identify things that are happening. It has things that teams can do, things that individuals can do. And it also has this really excellent diagram. These are the drivers of burnout. And these 7, what are they? Hexagons. These 7 hexagons are the core drivers. So control and flexibility, workload and job demands, efficiency and resources, meaning in work, organizational culture and values, social support and community at work, and work-life integration. And all of these drivers of burnout can either drive you more towards burnout with its 3 components, or they can drive you in the other direction towards the opposite of burnout, which is called engagement. So it's not resilience, it's engagement is the opposite of burnout. And that's when you feel invigorated, dedicated, and absorbed. So maybe some people out there feel like that. Maybe some people can remember feeling like that, but that's the absolute opposite end of the scale from burnout. So that article from the Mayo Clinic will say to you, really, if you want to do something, and you can do this in a team, it's a great thing to do. I've worked with groups of people doing this. You just identify what's the most important driver to you. It's a very interesting conversation to have with people you work with, because you sometimes assume they're the same as you, but they're not necessarily. So you say, well, actually, it's having control and flexibility. That's the main thing for me. And how can you get that? How can you make sure that you're going to get that in your work? You know, that's the most important thing. Do your colleagues realize that? And how can you prioritize that driver? So I think this is a very useful concept. Think of pushing yourself more one way than the other in terms of the systems, at the same time as addressing some of the individual things that you can do. So just keeping an eye on my time here. My watch has stopped working. That'll teach me to have a fancy Fitbit. My phone's going dead. It's all happening here. Okay.
You're fine, Fiona. We've got plenty of time.
Right. Thank you. So we're going to move on to selected strategies. Well, I'm exactly where I should be on my thing. Whew. And this is one of our slides from Connect, and we put everything on one slide, but it's useful to think about self-care strategies, I think, in sections. Often practitioners I work with are very good at doing 1 or 2 sections, and they often miss a section out. So they're great at looking after their physical health, and they're taking collagen and protein powder and have a whole, marathon schedule going, but they're completely isolated and not connected with anybody. And, so I think it's useful to think of what your gap is. It's quite, can be quite confronting to do this sort of thing and notice you have a gap. So it requires a bit of an open mind and a reflexive sort of mood where you think, okay, I'm up for a bit of reflection and I'm going to think about it. There's a lot of psychological strategies that you can use. Great techniques for managing worried thinking. So just to recap, worried thinking is where you're anticipating something happening in the future and in a negative way, and you're having a stress response while you're thinking about it. Okay, ruminating is when you're thinking about past negative stuff and you're going over and over it, and you're often having a stress response to that. So both of those things, anticipating future negative things and thinking about past negative ones, are often very cyclical and repetitive. Don't do you any good. They will be causing you to have a stress response at that time when you're not actually in a stressful situation. So one of the things that people do with mindfulness, and you probably like, oh God, oh, sorry, I didn't mean to do that. No, not mindfulness again. But mindfulness is a state of mind where you're choosing to put your attention in the present moment, okay? A state of mind where you're choosing to put your attention in the present moment. And mindfulness meditation is really the training, it's the brain training that you're doing to put your attention in the present moment. And for some people, it has spiritual meaning and well-being. It has a sort of side effect of well-being, or it's from a Buddhist tradition. But for other people, it's just a classic, I am training this bit of my brain that's good at attention and control, and I can do that within a few weeks, and I can expand it, and I can make my attention better. And then you can choose where you put your attention. So instead of slipping off into ruminating or worrying, you can notice when it does it. And that's why I think it's a very useful skill to have.
Fiona, just a quick
Yes.
question. What's the difference between mindfulness and grounding?
So grounding is, so mindfulness is a state of mind where you're choosing to put your attention in the present moment. Grounding is a technique that you're using to calm your stress response. So it's something like, and you might use mindfulness to do that. So you might think, oh, I've got a stress response. I'm going to feel my feet against the floor and use that to focus on, and that will calm my stress response. But the purpose of grounding is to sort of stop your stress in that moment. Yeah, instant moment is happening. So grounding techniques be often, let's say somebody's shouting at you, you might freeze, you might find that your brain freezes, you can't think properly because you're in a sort of panicky state, and you need to reconnect with that thinking bit of your brain. So you do that by taking a slow diaphragm breath, you're switching your adrenaline off. These are these things, techniques to calm your nervous system, grounding yourself. The other things you can do to do that are things like, your body is the thing that's going to bring you back when you're in that panic state. So you can clench your fists, obviously not if somebody's being angry at you, or curl your toes and then uncurl them. Something with the extremities of your body is going to take you away from all that thinking and hype and make you more grounded. Self-hypnosis I have for years. I learned it when I was a medical student. There's a lot of misinformation about it. We've put more information about it on the CALM website. I'll give you some resources in a second. But self-hypnosis, you basically do visualization or something like that at home. You practice being in a relaxed state. You're imagining you're next to a river, or you're listening to peaceful music or something like that. And your physiology is all very calm because you're in that moment, and you give yourself an anchor. Some sort of physical sign, and you just practice it lots, being in that physiological state with your anchor. And then when you're not in that state, you're at work or you're somewhere else and something happens, you use your anchor and it instantly brings back that physiological state. That's how it works. And it's very effective, can be very effective if you practice it. Sorry, I didn't mean to flick around. Connection to others is really important. Supervision, thinking about professional support as well as personal support. Where would you talk to if you had a work problem? Is your peer group just an educational peer group, or is it the sort of place where you would talk if you had a problem? Connecting to something that's fun. What do you do that's fun, and how much of it are you doing? Are the things you can do to improve your well-being with teamwork and systems. And there's a whole body of literature around the importance of meaning and purpose and values. And you saw it was in the center of that burnout organizational thing from the Mayo as well recently. So meaningful work, whatever that is for you, what gives you meaning and purpose and value in your life, and how can you make sure that you keep that bigger picture stuff there rather than trudging along in the daily grind. So it could be a 5-year goal or something like that. This is from a vet's wellbeing article. I just quite like 5 S words. I quite like little things like this. So they've got self-care, saying no. You know who you are out there, if that's your thing that you need to learn to do. I think with saying no, often healthcare practitioners are very helping people and can take on more and more. So choosing what you take on when it's within your control. Sometimes asking yourself, whose issue is this? Which part of this am I prepared to be responsible for or involved in? And then saying no to the other things. So some of that's around setting boundaries. Sleep. Increasing evidence about sleep and how important it is for well-being. If you want to know more about sleep, I think Matthew Walker is the person to watch. He's got a very good book called Why We Sleep, but he has lots of TED Talks that are about 15 minutes, Matthew Walker, Why We Sleep, where he summarizes a lot of it. Lots of evidence on meditation, the way it changes your brain, and with endorphins. Basically, endorphins are exercise, meditation, and laughter. So some people just say, do something that raises your endorphins. That's all you need to do. Here are some resources. This is a completely fantastic site. So the National Academy of Medicine has got this thing called a Clinician Wellbeing Hub. And you can actually get this logo, and if you click on it, it takes it straight to the site. And it has basically all the world leaders in clinician wellbeing. And this is a multi-practitioner evidence that they've looked at from nurses and pharmacists and all sorts of different health practitioners, doctors. And they have summarized virtually everything. What's the evidence for this? What is burnout? What's the latest thing? What programs are people trying around the world? They've got this great bit with case studies where they show you how people put something in place in their clinic, and they've written stories about how it worked and stuff. So it's really great, and it is updated all the time. So that's been a big project out of America for the last few years. This Canadian one, ePhysician Health, is pretty handy. It's very doctor-centric, if that's a word, but it does have some quite useful videos and stuff on it. And this is my favorite book of all time, which you can still get as a little book. It's been translated into millions of languages. It's very small. It only takes about an hour, hour and a half to read, and it's full of little techniques. Anne Williamson has put a lot of it on her website. And she is a retired GP from the UK, who's also done NLP training and in fact was head of the British British Hypnosis Society for years. But she's actually taken quite a lot of these techniques, and this is a very simple book. She's also got another book called Brief Interventions in Primary Care, where she talks about how she's taught these sorts of skills to patients, and she gives examples of good old UK consultations of 10 minutes and how she's done that in that time. So I'm a bit of a fan of Anne Williamson, and that's her website. This is a whole lot of resources for mindfulness if you do want to learn it. A lot of the evidence is from doing an MBSR course. They take about 8 weeks, and they're quite a standardized thing. You meet for an evening, you have stuff practice to do in the week. So there's different ones around the country, an MBSR course, mindfulness-based stress reduction. You can get a mindfulness-based self-compassion course, which has an element of teaching yourself to be kind and motivate yourself with kindness. But you can also do these things with workbooks if you want. The Mindful Self-Compassion workbook is really good. So if you're always driving yourself along with criticism, you can learn mindfulness and self-compassion at the same time through that. Or this Finding Peace in a Frantic World is really like the 8-week course, but it's in a book by yourself. If you're not going to do that sort of thing and you just want to, do it in a lesser way, this is Craig Hassed's course from Monash, Mindfulness for Wellbeing and Peak Performance. It's got quite a sort of, not a corporate edge to it, but slightly more so, and it's just a 4-week thing. Or you can just try one of these apps, Headspace, 10 minutes a day. You can get some of these techniques on board. I found doing 10 minutes a day about 5 times a week for about 2.5 weeks, started to notice a difference with my attention when I started doing this stuff. Calm website's a site that we made 2008 now, my goodness, where we put some of these things into audio files so you could practice them. I mean, I'm sure people are aware of lots of these and I can't go through them all. Black Dog's a great site for up-to-date one-pager things on anxiety or something. Always will have that information on it. Martin Seligman's site's more about happiness and well-being and positive psychology rather than being illness-focused. Has lots of great quizzes where you can put your own happiness levels in and compare them to others, and some techniques on there. Always keep an eye on the Mental Health Foundation. They have new things they put on all the time, like resilience workbooks, stuff like that. Anne Williamson's there. Big White Wall's changed its name to something else, but it's a very good UK site where people can write their feelings and it goes up on a brick in a wall. And they had counsellors tokens. You could buy a token and get some online therapy. Quite handy for here in the evening for people. And of course, good old Beyond Blue is a really excellent resource from Australia. There was quite a lot of COVID wellbeing stuff came out, and the Ministry of Health has got quite a bit on there, and the World Health Organization has got resources for it. I really love the stuff that this American psychiatrist, Dr. Judd Brewer, put out on his website, and he puts these daily videos out, and he's done it for months. And these are just some of them about managing anxiety during COVID and and they're just a quick, 5 or 10 minutes a day. And they are really excellent. So you can look up Judd Brewer has a TED talk, and then you can get the links through that if you're interested in doing that. So that is me. I'm aware I have bombarded you with a raft of information, but I'm hoping that each person can find one thing that resonates with them, that they think, oh, maybe I could add that in, and that you can find some information about it. Okay.
All right, so we're opening up the floor now for some questions. So feel free to type in anything that you'd like to either share with us as a group with Fiona or ask with regards to expertise. Just to sort of start off, Fiona, When we were looking into that space of potential psychological interventions, as you will, and sort of changing hats a little bit from looking at our self-care and how that may translate to the way that we practice in general practice. Now, we know that counselling and psychological therapy in general were actually very hard to access in COVID. So just sort of picking from some of the list of potential interventions, is there anything that you would recommend for us to take away and perhaps suggest to our patients through that lovely list that you showed us before?
I think with I think one of the difficulties is that it's a very personal thing. So people need different things for well-being, and they're the person that knows what that is. So I think unfortunately, there isn't a sort of one size, look, if you've got 5 minutes, do this or do this. With a lot of people, I've done some quite basic things, trying to catch things early warning signs. Identifying your early warning signs and linking them to some sort of action plan is a very useful thing to do with anybody, because it's about catching things early before they go down that track and spiral. So I think that's probably the most useful thing. You can teach people problem-solving strategies like that coping mechanism, that equation. Can you change demands? Can you change perceptions? Some people don't like problem-solving strategies. They would prefer to do a visualization or something like that. So you can give somebody access to something like the CAM website that has different things on it and let them try things out and see what they think and talk to you about it. I've known some practices where somebody has a spare small room and they let them use their website in there and click through some things and have a look at some resources while they're there. So I think that can be a really useful thing to do as well. But it's not very one size fits all. You can show people the categories and ask them what they think that they could strengthen. Because you could spend ages talking about sleep and nutrition, and the person in front of you could have optimal sleep and nutrition. So often we make assumptions, I think. So people are quite good at identifying, I don't really have any strategy for managing worried thinking and stuff like that. The ones I find are common with people are worry is very common. That Anne Williamson website is really good. The book, it only costs about $7 if you get it on a Kindle, but the website now has a lot of that stuff for free on it. So I think worried thinking is a very, very common thing. There's a very useful technique you can use, which is from Anne Williamson's book, actually, called a worry technique where you get a book, and if you have worries, you write them in your worry book. So you don't keep going round and round in your head. You might put the worry book next to your bed if you're waking up at night doing that. And then you have a worry time, and you might be Tuesday, 7 o'clock. Oh, not if there's a Goodfellow thing on, but whatever day, Wednesday, 7 o'clock. And and that's when you get your worry book out and you have a look at them. Often you'll have written the same thing several times, which is interesting. So you felt like you had 20 worries, but you actually had 10. And then you divide them into bigger picture worries. So that might be something that you can't personally do something about, but you're worrying about, like, I don't know, Donald Trump, just picking something I've been worrying about. And then you might have things that are somebody else's worries. So that's quite an interesting thing. Asking yourself whose problem is this, any part of this is mine. And then you're left with the ones that are actually your worries that you can problem solve. So that's a useful technique. And I've taught that to a lot of patients and to students in my role at the medical school as well.
Now, just sort of wondering about your thoughts around fact and act, and certainly you sort of identified particular categories where people might want to be acting on certain things. So some of it, by what you're saying, appears to translate quite nicely to that area. So can you just talk us through a little bit about that?
Bruce,
I
think there's quite a lot of information, isn't there, about ACT and acceptance and commitment therapy, and FACTs, a sort of shorter version of it, I suppose, because ACT came from the sort of therapy world where it was a longer model you have to work off. But a lot of it's about awareness, noticing what's happening, which in fact is mindfulness is in there, isn't it? Like you're noticing it at the time, and then you're noticing what's happening, stopping yourself going down that usual path, and then you sort of take a positive action. So you sort of stop yourself going down that negative path, and you think, oh, now I'll go for a walk, or I'll get some fresh air, or So there are techniques you can learn. There are different structures. I mean, I won't go into all that now, but this material is actually quite easy to find on FACT and ACT out there now. Have we got any at the Goodfellow unit, Grace? I'm not.
I think there are a few courses that
Yeah.
are available.
Yeah, Bruce Arrow's taught a lot about it, and he will have those modules out there. But the courses, you can do quite a short course and then put it straight into play. Russ Harris does a lot of those. You used to have to go to Australia. He is doing some online now, and that's where you can get that training as well. He also has books that you can read about it. Russ Harris, he writes about it in quite a straightforward way as well.
Okay, thanks for that. Now, just sort of wanting to look at that issue of sleep and wondering if you had some understanding of the current literature that suggests the potential adverse effects of shift work on our sleep and therefore our physical health.
I mean, I think there's a lot of emerging stuff on sleep at the moment, and it does seem that it has a bigger impact on a lot of our systems than had previously been thought. And I think one of the sort of myths, in fact, that now it used to be, some people need a little sleep and some people need a lot. Now it looks increasingly like we all need somewhere around 7 hours. There are a few people that need less than that, but most of us, if we're having regularly shorter than 7 hours, you will have negative effects on your health. So I think it's useful to thinking about sleep procrastination is a thing that is quite common with people. You feel like you haven't had any time to yourself. So then you get home, so then you stay up later because you're going to have some time for yourself. And then it impacts on your sleep, it impacts on your psychological health and on your physiology. So that's quite a useful thing to notice in yourself and in patients is whether you're doing that sleep procrastination. But I think if you want to know about sleep, I would look at Matthew Walker's book or his TED Talks. He's a professor of sleep, and that's not his title, but that's what he does. And he answers all those sorts of questions and is very up to date.
Okay, now just sort of moving more into that collegial and organisational space, do you have any recommendations addressing burnout in a colleague if you're worried or concerned about them?
Yes, I think firstly, remembering that there are always organisational components as well as individual ones. So, and sometimes it can be easier to notice it in colleagues than in ourselves. So often if we're working with somebody in the same system, we may well have components of burnout ourselves. Because sometimes it's easy just to think, oh, it's just that one person or something, but they could have it more severely or be exhibiting the symptoms first. I think a useful way to do it is to pick your time. It does depend on your relationship with that person, but really just to bring it up in a concerned way. So a phrase I would use is, I've noticed that, and I'm concerned that, and I would give a specific thing that I'd noticed and that I was worried about. And you can also use some normalizing in there. Lots of people find when they're covering for someone on holiday, their workload doubles and they suddenly find it overwhelmed. And I've noticed recently you've been talking a lot about this, or that you're coming in late, or that you're, and just whatever it is you've noticed. And I think that I've noticed that, and I'm concerned that conversation, your helpful, kind intention, if you pick the right space and privacy, is a very good way to do it. And I have done that several times in lots of different situations and have never had a negative reaction, because you're not assuming anything. And if you have picked it wrong, somebody will say, oh, no, actually, I'm fine. I've just got my, whoever is staying at the moment and they're wearing me out. But they're really pleased that you asked them. I even did it with somebody after a Zoom meeting where they just were not themselves in this group. And I was worrying about it the rest of the day. And then I thought, right, I need to actually ask them about it because something's going on. So I would keep that handy phrase if you find it useful.
That's a great tip. Now, there's just a question or two in there around some interest of talking around the organisational steps that we may take in terms of addressing burnout. You alluded to it and mentioned it in the latter half of your talk, but just wondering if you could just expand on perhaps some of the resources or other steps that we can take if we are in the fear and needing to use some of those tools.
So I'm trying not to glance at the questions because then I can't think and answer them. But somebody's saying there's some resource they can't get. If you go to the NAM site, the National Academy of Medicine Clinician Wellbeing Hub, which I checked tonight just before I came on, a lot of these resources are on there because they just make them freely available. So that's a really good place to go. If I were asked to address burnout in a team tomorrow, I would get that article. I gave you a link to it. It has a page on it that is like a grid, and it has individual things, team things, sort of practice things and nationwide things that you think are affecting you for each of those 7 components. And then you just work as a team and you can circle them and say, I think it's this, I think it's this. Often you'll find in a practice or an organization that everybody points to the same thing. Okay, and then you think, right, we've got a real problem going on here with our, you know, work demands or whatever it is. People will often identify the same thing. The other thing that's on that site is this conceptual model of clinician well-being, and it has all the external factors that can affect well-being. So that's all the sort of things happening in the system and all the internal ones. So you can also highlight things on there. And I think to do it as a team in a very non-blamey way, thinking about let's together try to address any systems factors. In that same article, it gives you an exercise you can do where you identify one thing to change as a group. And how do you do that? You know, right, we're going to make a change in this, you know, change the quality of this, change this. This is a thing we can change, and how you can work on that together. So I think it's about not making assumptions and asking. And when I've done this with groups of people, invariably, you know, 90% of people will highlight the same things, but they just haven't spoken about them together.
It sounds like it would be a very revealing discussion in a good way.
Yeah, you need to choose where you do these things, and you can't force people to do them. And so it's all about how you set it up, I think, and trying to find a common goal. You know, finding a common goal with your colleagues might not be quite the same as yours, but there's probably a common goal that you'd all like, and then saying, well, why don't we have a look at this together?
And Fiona, just a reminder again what the article was.
So that's that. I'll send my slides, but that's the Mayo Clinic article that was on my slides. It said organizational strategies, and it's called 9. I've got it in front of me here, but it's like 9 organizational things that you can do. I just call it Mayo Clinic. Just let me find it. Shall I share it again? I shall go back. Oh, you've probably got, I shall scroll down and tell you what it's called. So it's called Executive Leadership and Physician Wellbeing, 9 organizational strategies to promote engagement and reduce burnout. And you can actually Google that and you'll get to it, but it's also on the Clinician Wellbeing Hub. And I did try that tonight. Oh, somebody's just suggesting adding Attending by Ronald Epstein to my list. Great, thank you.
Lovely. Now, just perhaps one or two more questions before we wrap. Someone's wanting to know what your advice would be around individuals that have physical health concerns, and this is really quite common. We see a lot of somatization in general practice. Some of the techniques that we use in general practice, if we look at things a little bit on the aside, so we talk about grounding, we talk about sort of feeling our way through the issue. Sometimes what can be, rather than just looking at the physical symptom and then just acknowledging it, actually connects them to their somatization and makes it worse. So for these sorts of individuals, what would be your go-to in terms of trying to disconnect that?
I think the key to mind-body interactions and helping with that is to get the patient on side with the understanding that the physical and the psychological go hand in hand. So lots of sort of normalizing, I think, is key so you're not, because often people feel defensive, and you can imagine in your own situation, you know, that you're saying their pain's not real or their diarrhea is not real, or and you're not saying that. You're saying, you know, you have got this, you've got this symptom. Often when people have these things, often there's a psychological thing going on as well. And if we treat them both together, we're more likely to get a better outcome. And getting somebody on side with physical and psychological things going hand in hand, I think, is the first step, and doing lots of normalizing about how common it is, and a lot of those conversations using we, if you can, without being patronizing. And so I think that would be my first thing, to get buy-in, because otherwise you're trying to teach somebody something when they're just not listening, because they're thinking, well, you're telling me that I don't have these symptoms and I do. Okay. Another core thing from what I've read and in fact practiced with these sorts of symptoms, especially when somebody keeps coming back, is it's really important to acknowledge the impact of the symptoms. Okay, so you don't need to necessarily fix it. And I have tried this with people. It's very interesting. So instead of thinking, oh God, here comes that person again, I can't do anything to help, oh no. Ideally, you want to make a time to see them more regularly, so they're not feeling shoved away, which is sometimes the opposite of what you have been doing. And you get them to tell you about the impact of their symptoms. And then you do some therapeutic listening where you really listen and try to understand what the impact is. And you do some very sincere reflecting. It's interesting what you learn, actually. And so you're basically saying, oh God, so you used to be able to, run a marathon and stuff. And now ever since you've had this, you're actually hardly even able to walk upstairs. That must be terrible. It's so different from how you were before this. And that sort of real acknowledgement is very powerful. And I found it's quite interesting how commonly people's symptoms start to resolve once you start to acknowledge the impact of the symptoms. Not always, but sometimes it's almost as if the symptoms turn the volume up when people aren't listening and are shoving them away. And when you start to ask and properly listen, it can work. I'm not saying that it would, but often we have to do a bit of both there. But there are two things that I have found that help.
That's a great tip, and certainly it's something definitely that I can take away to my practice as well. So thank you for that.
Somebody's saying the JAMA network physician self-care at the end of life. I think if you go through JAMA, it doesn't work. But if you Google being connected, a key to my survival, it normally takes you to a PDF for that article.
Great, thank you. Guess what, Fiona? We're on time.
Phew.
You've done very well. Look, I think it's a really good time to thank Fiona and wrap it up for tonight. Thank you everyone out there in the audience for participating in some of that sort of shared dialogue that we had. That was really useful. So have a great night, everyone, and please don't procrastinate on your sleep. Look after yourself, and talk to you soon. Cheers.
Thanks, Grace.